Hello, this is Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. This is a really quick take on a recent federal court ruling of the FDA versus U.S. stem cell. Essentially ruling in favor of the FDA and against U.S. stem cell, upholding the FDA's guidance and ruling of shutting down U.S. stem cell. Essentially, for those of us who are in the field, practicing, understand sort of what's at stake and what's been going on, this is not entirely unexpected. The FDA has some very defined set of criteria that they've been talking about for the last couple of years about what's in bounds and what's considered out of bounds. U.S. stem cell was clearly out of bounds. Namely, they were utilizing adipose or fat stem cells and using an enzyme called collagenase to break it down. A really clear violation of what the FDA means by minimal manipulation. So from a really practical standpoint, really expected, not something too surprising. This may seem relatively controversial to either physicians or the lay public who have not been paying as much attention that physicians who are currently practicing in the field are actually somewhat happy about this. Some of us are. Namely because the FDA has guidelines and they're sticking with them. They're being clear about what those rules are. As a contrast, using your own blood or platelets, as well as using your own bone marrow derived stem cells, is currently thought to be within the guidelines of FDA regulations. It's a really, really good thing that the chief regulator in the United States, when it comes to U.S. healthcare, is on board with physicians who want to push this field forward. As much as regulators and physicians can be thinking in the same manner when it comes to patient safety, this field can continue to grow leaps and bounds. So this news is really good news, bad news for the company, but really good news for the field and allowing us to push forward. Thank you for your time. Leave me your thoughts. Love to know what you think, and have a good day and live well.